Hello, I'm Brian Prescott with PCCA. I'm here with Dr. Brian Futrell. I'd like to talk a little bit about diabetes management and wound care.
Excellent.
Where does a pharmacist fit into that, and where do we fit in with the healthcare team?
Oh, excellent. The key word there that you brought up was team. Diabetics require a team. Myself as a wound care expert, the internist, if we don't have good glucose and we don't have good hypertensive, basically the patient in general managed, if the nurse isn't maintaining the wound environment, if the nutritionist isn't really driving home the importance of good protein intake and glycemic index, if the prosthetic or the orthotist isn't there to help us offload the foot, if the pharmacist isn't there to help us put together these combinations and the SpiraWash and the Practitioner, if we're not able to utilize the technology that we have available in a team environment, ultimately the patient's going to lose. And so really what we can do is bring the pharmacist into this team environment where unfortunately they've been a little bit absent in the past, where it's time for them to bring their expertise, their input, and ultimately through PCCA, a new line of technology that's very, very adaptable to the wound care environment and the wound care team.
Well, thank you, Dr. Futrell. Obviously, diabetic ulcers are some of the hardest to treat, but do you have any take-home points for our audience?
Well, one is they're hard because of the patient. I don't mean that to be funny, but ultimately you have to get the patient on board with what you're doing, right? And secondly, you have to work with your internist. Myself, as a wound care specialist, I can only take that patient so far to creating a natural or good, healthy balance with their nutrition. So you have to have that relationship with the internist. And lastly, it's about pressure. So if you don't offload the wound, nothing we put on the wound is really going to make a difference. So please, take care of that pressure for me. Thank you.